I have chronic asthma, but sometimes I leave my medication at home. But I feel safe when I do this because I could go to the clinic and get the medication I need.
It's wonderful to have a health center in this school because I'm diabetic and I don't have to miss any classes. I'll come before lunch, check my sugar, if everything is okay. I'll go straight to lunch and eat.
I'm glad that it's in my school because it's convenient. I don't have to miss any classes and I can go right upstairs and get myself checked out and make sure everything's good with my body, you know?
Healthy students are more likely to perform better and succeed in school. School-based health centers are located in underserved areas with limited access to healthcare services and have provided on-site primary care to students for over 20 years. There are 123 school-based health centers serving approximately 150,000 students in New York City, and these numbers are growing. They offer comprehensive health services free of charge, regardless of immigration or health insurance status.
Part of educating the whole child is not only to look at the cognitive development of a child, but also to look at the emotional and physical development. When I walk into the health clinic, I see it's packed always. When you provide the services on site, you have access to the kids. They don't miss classes, they don't miss school. That gives them that accessibility that they might not get in their neighborhoods.
I feel very fortunate to have the school-based health center in the school because I don't have to worry about missing work. I don't have to worry about my kids missing school or falling behind because I had to take them to the doctor to get a shot.
My son is an asthmatic, and I feel very safe that the school provides a school-based health center for him. And he gets treatments, and I'm notified about it right away.
The SBHC can serve as a student's primary care provider or complement services provided by an outside doctor. They are usually staffed by nurse practitioners, physicians, medical assistants, and health aides. Some health centers provide additional services, such as mental and reproductive health, vision and dental care. If a service is not directly provided, the staff may refer students to outside specialists.
We work with the students from the first day they enroll in the school-based health center. We offer a variety of services, physical exams, screening for vision, anemia. We deal with chronic conditions such as diabetes, asthma, seizure disorder. We screen for mental illnesses such as depression, anxiety. We provide immunizations. We also provide reproductive health services for students who ordinarily wouldn't have that readily available to them.
I'm a firm believer in public health, and the school-based health centers is where that happens. I can't stress enough how important it is for all parents to take advantage of the services that we provide, even if you have a provider outside, because it means that we can provide that service when that child is ill in the classroom, and that child will continue to go back to his room and continue to have his academics. It's beneficial for everybody.
We have several students who have asthma here. They get their maintenance visits here and their acute visits. This is a way so that they can stay in school and they don't have to go to the emergency room or their primary care physician.
Good health is more than just the absence of illness. There's a lot of teaching that goes into it. There's a lot of self-management. There's a lot of recognition of what you need to do to be a healthy person. And I think that this is a really logical model to take care of children while they're in school.
I am part of the track team, and as a member, I need to have an updated physical for me to be able to participate and run. Having the clinic in my school is very convenient because I could just come straight down and make an appointment, and it's quick and fast.
Well, I come mostly here because I characterize myself. Right here is comfortable for me. I'm very independent. I do everything by myself. And I usually come here at 11:15. I take half hour, then I go to my class. Everybody here knows me. It's a great place. They help me a lot.
I do see the counselor here, and I do talk to her often about problems and situations that I have in school and at home.
Students come to see me maybe for depression, if they're coping with anger, anxiety, sometimes having a significant trauma history. A lot of kids come in when they're being bullied, maybe because of their sexual identity or because of a learning disability. So we try to sort of help them come up with different coping skills, different ways to think and respond to their stress. And it could either be an individual one-on-one therapy or sometimes in group settings too.
I'm very happy that we have a clinic in our school. Every Thursday I come to this group. It's about homosexual, lesbian, and bisexual. That we talk about life We talk about how to respect yourself.
Sometimes if I need to get something off my chest or if I need counseling, anything, I could just go and, I'll be good. Since I've been talking to the counselor, my grades have gone way up.
When a child comes into the school-based health center, they not only get preventive primary care, emergency care, but they also get to establish meaningful relationships with caring adults that can also serve as role models for these children.
It's difficult. I have a lot of students who will come to me and they say that their friends don't have something like this. How can their friends find a service like this? And I wish that there were more school-based health centers. The students who come here are lucky to be able to access all of this. I hear that on a very regular basis.
From basic health care to health education and disease prevention, school-based health centers protect our kids and empower them to make healthy decisions. We are working to build and develop this powerful model in more underserved schools, making a positive impact on kids' lives to better our community. Investing in our students' health care is probably the best investment we can make.